In just over 5 months' time, Vancouver will welcome hundreds of thousands of football fanatics for the FIFA World Cup. But with ER wait times a concern across the country, some doctors are questioning whether we'll be ready.
Are we prepared for that type of event in our cities? And do we have surge capacity?
Catherine Varner is an emergency doctor in Toronto and says her hospital is regularly operating at capacity and fears the impact an influx of visitors could have on the already taxed system. However, out here on the West Coast, after over 2 years of planning, experts are confident that the healthcare system will be ready for kickoff, pointing to the 2010 Olympics as a key indicator of the city's ability and readiness to welcome the world.
I don't think there's a lot of great evidence that the health system buckled under the pressures associated with the Olympics.
Dr. Jason Sutherland, director of UBC's Centre for Health Services, says there are plenty of steps that governments can take to mitigate the risk in the lead-up to the Games.
And that could include such things like hydration stations if it's very hot outside, or sunscreen dispensaries to block sun so fewer people get sunstroke.
But not all emergencies can be easily planned for.
Of course, there's always the risk of an outbreak, foodborne or infectious disease like COVID. However, those are rare and certainly going to affect people no matter what. It doesn't have to do with FIFA and the soccer tournament.
People who run our emergency rooms, they're constantly looking at things like this. What are the volumes coming in? How many staff do I need on today? And, they're making those little changes and, they're going to have to make those during FIFA as well.
Dr. Mark Lecision has been working on planning and logistics for the Games for the past 2 years and believes hospitals will be able to adjust and adapt to any challenges that may arise. And while he admits there is inherent risk in hosting any major event, that's no reason to not go ahead with them.
And so we have to find ways to kind of make sure our systems can handle them, as opposed to just saying like, oh, there's all these risks, we can't do this.
In Vancouver, Kurt Black, City News.